Local Women Magazine presents Local Women Podcast, the show for things that matter. The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to Local Women's Aesthetic Podcast, and I'm Emma Heaney from Reid Aesthetics, and I'm the host of this podcast. I have the absolute honour and pleasure to invite both Brenda McKibbin from Reid Medical and Tara Jamison from AlterEgo. She's also a senior injector in Reid Aesthetics as well. So welcome, ladies.
Hi, Emma.
So today we're actually going to discuss aesthetics in Northern Ireland, and we've come into September, the children are back to school, and what treatments are we finding really popular in our clinics today?
Well, for me, it has to be a bit of a refresh. People are coming in for their toxin treatments because they've been a bit stressed with the kids being off school and they feel a bit haggard. So it has been the number one treatment for me so far in September. I also try and educate my patients into looking after their skin in the autumnal and the winter months. So we're putting some treatment plans into place for patients to look after their skin during the winter months.
Lovely. And Brenda, what's happening in your clinic at the minute?
I usually advise my patients autumn, winter to do the things that you can't do during the spring and the summer. So the microsclerotherapy, because for injecting the veins, the spider veins in your legs, it's not a treatment that you can have during the summer because you've got your legs out. So it's a good time to be able to wear the long socks and the boots over the winter. And then the same as what Tara was saying there, the peels and facials, because everybody's back for their holidays, they've been exposed to the sun, and they really need to think about getting their skin prepared again for winter after damaging it in the sun, even if they've had their SPF 45 on. So
it's very much the same in Elite as well. We're doing a lot of toxin treatments, skin rejuvenation. Chemical peels for me is really October time for our clinic, because I'm getting them ready then for the festive period. And we know there's a big treatment that everybody's been talking about, and it's been in the media quite a lot, and it's known as the sperm facial. I know, Brenda, you wrote about it this month as well. It was really, really good. It's in the Local Women Magazine. But it's not really a sperm facial, as we all know. I mean, I had brought this back from Monaco 18 months ago. It was really the treatment back then, and it's a polynucleotide. Brenda, do you want to tell me about the sperm facial? I know that Jennifer Aniston's a massive fan, Kim Kardashian, so we all jump on the bandwagon, but it's science-backed. I mean, this is a really, really good treatment.
Yeah, so polynucleotides are taken from salmon or trout sperm, and the molecules are then refined and processed, so it's not actually salmon sperm you're getting injected. And it's given not too deep into the dermis, and the whole process of it is that it stimulates the collagen, which will plump the skin, the elastin, which tightens, and then your fibroblasts, which produces more collagen and elastin, but also is like an antioxidant and eats up all the oxidants in your skin. So I think it's probably, along with the Botox and the fillers, the most popular in my treatment. And I would say if I had to choose one thing, like other than Botox, I would say polynucleotides are my favourite.
Totally.
Definite favourite.
Yep.
And I think it's misleading, but to say a facial, because for me, it's an injectable treatment.
No, it's definitely injectable.
For me, a facial is where you lie and relax and get pampered, but getting maybe 30 needles either side of your face isn't just as relaxing. But you know what? It's not painful. It's a wee bit uncomfortable, but the results are well worth it.
But you have trained in the company that does one of these treatments.
Yeah.
So how would you explain how many treatments a patient would need?
So with regards to polynucleotides, we have been doing them in clinic now for 4 years, which seems a long time in comparison to the latest trend brought on by Jennifer Aniston and the rest of the Hollywood elite. So I do have patients who've been using them for 4 years. And one of the things that I have learnt, that actually the younger you are and you start these, the better results you're going to have. So basically, how I explain this to my patients is that they go in and they clean in and around the cells. They help the fibroblasts to be able to work better and create more collagen, which in turn will increase hydration and increase the elasticity of the skin. So you think if we are doing that from a younger age where the fibroblasts are actually working really well, we're going to make them work better and actually prolong the signs of youth in our patients. It's harder to turn back the clock, but it is really good for giving them that kick up the backside that they kind of need and get them working more efficiently. So usually with our polynucleotide treatments, we would recommend a course of a minimum of 3, up to 6. I usually say 1 syringe per decade, and they're done 2 to 4 weeks apart. And then to keep that up, it's usually 1 or 2 every 6 months, or else you can do a full course again after a year.
Definitely.
I would probably say from mid-20s upwards.
Absolutely.
Because that's when your collagen and elastin starts to deplete and go down. I mean, if there was somebody 18, 19 coming in, unless it was for treating a wound or something like that, or alopecia, hair loss, because they're also good for that treatment. But I would do 2 to 3, and then every 4 to 6 months, just 1, unless the patient was old and had a lot of wrinkles. And also they come now combined with hyaluronic acid mixed in it. So again, that is better, in my opinion, for the older clients that need that bit more moisture and hydration in their skin. I think as well, for the public with safety, because the polynucleotides are based in a water-based gel, that there's no fear of vascular occlusions unless it's given with the hyaluronic acid. So it's pretty safe injectable to use, especially for somebody that may have fear of the side effects of fillers. And the fact it's been used for many years in wound healing and wound management, going back to all your rejuvenation treatments like your PRP and your microneedling. So people are going more for this natural look rather than the overfilled now. So
yeah, I think we are definitely taking, I mean, aesthetics, I've been in for 12, 13 years, and we've gone from that full overdone look to a much more natural approach and a much more natural appearance. I do believe, I mean, I love polynucleotides, and again, I know most of the people will know it as a sperm facial, and we talk about, the free radicals and everything like that. But for our patients, it's going to minimize fine lines. It's going to improve the quality of your skin. It's going to improve the color of your skin as well. Really, really good for the dark circles under the eyes as well.
Definitely.
I think the eye treatment for me is the most popular in our clinic.
Yeah, me too.
So, and I actually was talking to one of the representatives of one of the products at the weekend at that conference, and she was saying it's skyrocketed ever since it's hit the media. But yeah, polynucleotides have been around for a very long time. And it's great when I get phone calls now to the clinic and people are actually, instead of saying, oh, that facial that was on TV, they're asking more for, they actually call it polynucleotide. Yep. Which, it shows that patients are educating themselves more and are going for a much more natural appearance.
Yeah.
Fillers, when done right and small and often in the right place, it's beautiful and in the right plane. But not everybody wants to have that look. So I think the whole sperm facial, as we call it, but it's really the polynucleotides, the regenerative medicine, is definitely the way forward in aesthetics. It is for me anyway.
Yeah, regenerative medicine is the buzzword of the moment, isn't it? People want to be able to metabolize their own aging process on a cellular level and slow that down and be able to replenish and rejuvenate without overfilling or without adding anything to
over-enhance, perhaps?
Over-enhance, that would be it, yeah.
I think as well what you were saying, Tara, it's a good point. People argue about the age somebody should start getting Botox. Mm-hmm. And I would say that it's placed in the same sort of age, but between the 25 and 27, because if you're getting something that's going to plump and tighten your skin from that age, you're not going to need as much fillers.
Yes, absolutely.
Because your skin's not going to lose the same amount of elasticity and collagen. So, yeah.
It's all about educating your patients too, isn't it though? Because if we're educating them on how to care for their skin to prolong their youth, the less invasive treatments they're going to need through time. And it's just empowering them to be able to take control of their aging process.
And I think skin is the way forward.
Absolutely.
Definitely. It's massive in our clinic.
Yeah.
You know.
When I first started, the focus was on lips and toxin. That's all I ever did at the start. And then the more I learned myself and the more I was able to educate my patients, it's now skin and my opinion. They value my opinion. They'll walk in and say, well, can you tell me what you think? What would be best for me? So, education is definitely key for the patient.
I do have a concern about the so-called TikTok skin, where they come in and they're trying nearly every ingredient because TikTok said this. I think your source of information is extremely important.
Absolutely, and it is a bugbear of mine. Social media, I wouldn't be where I am right now in my business without it. It is a great tool. However, it is a landmine of misinformation, illegal practice. Like there is literal blatant illegal practice on it. So it's trying to weed out what's right and what's not. And that can be difficult for patients and for the general public to ascertain what's right and what's not. Because you can have pages with millions of followers who look really professional, who are not doing a professional job. And you can have someone who's atop of their game with maybe 600 followers, So it's really important to be educating and be able to weed out what's right and what's not.
We're going to move on slightly. We've talked about the different treatments. I know for myself, I've had loads of treatments over the years. I mean, I tried and tested, and I'm sure yourselves have had a few.
Yeah.
What's a treatment that you've had done that you probably wouldn't have again?
I'm very reactive, as you know.
We do know, and I know personally that she's extremely reactive.
So, any sort of microneedling or like strong peels, which you would think would be fairly safe, my face will.
Well, she does.
Yeah.
Wow.
Yeah. I mean, I could inject
she did it on camera with me one time.
It's not.
No way.
Brenda.
So I have to go easy, topical, I suppose you would say.
But you're amazing with injectables. You're fine from that level.
Yeah, when I get them injected to myself, yes. And I wouldn't discourage anybody else. It's just I think I have got an overreactive immune system that on my skin or something that just reacts, swells really easily.
Yeah. What would you tell her?
Do you know what? See, on reflection, I don't think there's anything that I wouldn't try again.
I am the same.
I've had threads, I've had filler, I've had toxin, I've had polynucleotides, radio frequency microneedling. I've had a lot. And you know what? Yes, there's downtime and stuff, but if I'm prepared for it, I'm fine. Yeah. So no, fill me up and tuck me up and whatever else.
Yeah, I'm probably the same as yourself. And I've had a few swellings and downtime, but I think I'm okay. And when Brenda's talking about being reactive, we did your face on stage one time when it was getting filmed. And as I'm treating her, she says, oh, by the way, I'm really reactive, which was really bad timing, by the way. But microneedling I love. I absolutely love it. And I mean, I do my own microneedling. I'm a dermapen trainer. Yeah. So I've been doing microneedling for years. But I think it's a fantastic, if you're a little bit nervous about injectables, that's a good way to go.
It's so undervalued.
I mean, the thing is, if you react as well within a couple of days, it's back to normal.
Yeah.
It's back to normal and it's good result. But that wouldn't be a normal situation.
No.
Nobody would, but just the question you asked, that would be me. I couldn't have it done on a Wednesday and be going a wedding on a Saturday, whereas a lot of people probably could.
Yeah. Not about 24-hour downtime redness.
So I think the advice is, if you've never tried anything before, make sure you have a go at before any major events. Anything really, because anybody can react too.
Yeah, well, I don't actually inject a bride for a month before her wedding.
Mine's 6 weeks.
You're 6 weeks. I'm 4 weeks. I'll not inject a bride.
And I would prefer that they've maybe came a few months before and tried the toxin so that they are happy with the way it's in.
I like to make them through the year in advance, so we can look at skincare and things like that as well. Yeah,
well, that's the ideal. But when you come into I'm getting married, or we've just been announced I'm getting married in 6 months, what can you do?
Exactly.
It's a quicker plan. But I do believe it. Your consultation is so important. Figure out what they want, what their goals are, can we achieve them, manage their expectations.
And just on the note as well of reactions, they are very possible. They're few and far between, but they're very possible. And the one thing that I think people need to look for in an injector is someone who's a prescriber and complications trained, so that they can then have a protocol in place to be able to assist you during your recovery. So I think that's important to point out as well.
On that note, I will cover my own personal journey on the next podcast. So thank you very much, ladies.
Thank you, Emma.
Thank you.
You're very welcome.
Local Women Magazine presents Local Women Podcast, the show for things that matter. The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.